All right, today we're going to jump in and demystify a technique that's quickly becoming a go-to in regional anesthesia, the Erector Spinae plane block, or the ESP block. We're going to cover what it is, why it's gotten so popular, and, most importantly, the practical steps to do it safely and really effectively. So let's dive right in.
And hey, this isn't just hype. You don't have to take my word for it. Experts in the fields like Dr. Amit Pawar have called this a total game changer. The ESP block has really fundamentally shifted how we think about managing pain for a whole host of procedures. Today, we're going to see exactly why it's made such a big splash.
Okay, so what is an ESP block really? At its core, it's what we call an interfascial plane block. Basically, the whole goal is to get our local anesthetic into this tiny potential space right between the big erector spinae muscles and the bony transverse processes of the spine. So here's what we're going to cover. We'll start with how it works, then get into why you'd even choose it. After that, we'll get practical with a step-by-step guide, and we'll wrap it all up with the drugs, doses, and some crucial safety tips you've got to know. All right, first up, let's get into the nitty-gritty of how this block actually works. Because while we know it's incredibly effective out in the real world, there's still a little bit of a debate about the exact mechanism behind the magic.
So, the most popular theory right now is that the local anesthetic doesn't just hang out where you put it. It actually spreads forward through these little gaps and sneaks into the paravertebral space. And that's huge because it lets the medicine block both the ventral and dorsal rami of the spinal nerves. That's why it works so well, and that's exactly why people started calling it the paravertebral by proxy.
Okay, so we know how it works, but why has it gotten so popular so fast? Well, the answer really boils down to two things: its amazing versatility and some major advantages it has over older, more traditional techniques. For one, its uses are just incredibly broad. We're talking about providing great pain relief for everything from super painful rib fractures to major surgeries on the spine, chest, and even the abdomen. This ability to cover such a huge area with one pretty simple procedure, that's a massive part of its appeal. And this is where it gets really interesting. When you put the ESP block head-to-head with something like a traditional epidural, the advantages just pop right out. It's thought to be safer for patients on blood thinners. You get to dodge all those epidural hassle factors like big blood pressure drops or urinary retention. And honestly, it's just technically way easier to perform. Okay, let's get to the fun part, the how-to guide. We're going to walk through step-by-step how to perform this block safely and effectively using ultrasound. This is the core of it. Okay, finding your target is absolutely everything. So you're going to start by placing your probe in that parasagittal view way out to the side. There you'll see the classic bag of marbles look of the ribs with the bright sliding pleura underneath. Then just slowly and steadily slide that probe medially back toward the spine. And what you're looking for is this really key moment where the rounded ribs suddenly turn into a flat, squared-off piece of bone. Bingo, that's your target, the transverse process. And this slide really breaks down those visual cues you're looking for. Out laterally, you've got those rounded ribs with the bright pleura sliding along. But as you move in medially, bam, you get that squared-off transverse process. It's usually a bit more superficial, and the pleura seems to just drop away out of view. Nailing this transition is honestly the whole key to finding the right spot. All right, you've got your view locked in. Now, it's needle time. You'll advance it in plane, aiming right for the corner of that transverse process. You might feel a little pop as you go through that deep fascia of the muscle. And right at that point, a tiny test injection, just a 0.5 ml or so, is non-negotiable. This is called hydrolocation, and it confirms you're in that perfect fascial plane. And here's a huge pro tip you'll hear from the experts. Aim for the edge of the transverse process. So why does that matter? Well, if you aim for the flat middle part of the bone, it can be really tough to get your needle tip to slide cleanly underneath the fascia. Aiming for that corner gives you a much better angle of attack to pop right into that potential space. And this is the money shot. Your confirmation here is 100% visual. When you get it right, you will see the erector spinae muscle just hydrodissect and literally lift right off the bone. You'll see this beautiful dark stripe of local anesthetic spreading out. That's the anechoic stripe, and it tells you you're exactly where you need to be. Awesome, the block is in. Now, what do we actually put in there? Let's talk about the drugs, the doses, and how long you can expect this thing to last. Now, one thing to really drill home is that the ESP is all about volume. It's a volume-dependent block. You need enough liquid to spread up and down that fascial plane.
So for adults, you're typically looking at 20 to 30 mils per side to get that really good widespread coverage.
So what are we injecting? Well, you're almost always going to reach for a long-acting local anesthetic. The most popular kids on the block are ropivacaine and bupivacaine, usually at these more dilute concentrations. With a single shot of these, you can usually count on a solid 6 to 12 hours of pain relief. And of course, you can give your block a little boost with some adjuncts. A lot of people add a little bit of epinephrine, it can act as a marker, and might reduce the risk of systemic toxicity. And many clinicians are now adding dexamethasone, which has been shown to stretch out the duration of the pain relief even longer. Okay, let's bring it all home and talk about the most important stuff, safety, and some final tips to make sure you succeed every single time. So let's kick this off with a question for you. Even though the ESP is considered super safe, what's the one potential bad thing you really need to be watching out for? Yep, the big one to watch out for is LAST, local anesthetic systemic toxicity. It's rare, but it's serious. Think about it. We're putting a lot of volume into a pretty vascular area, so you absolutely have to monitor your patient closely for a good 30 to 45 minutes after you're done. And it goes without saying, you should always have your last rescue kit ready to go. All right, so to wrap it all up, let's run through the biggest takeaways for a perfect block. First, always use hydrolocation. Second, make absolutely sure you're under the muscle, not in it. A great little sign is seeing the muscle drift back down when you stop your test injection. Also, remember this anatomy is complex. It's not just a simple sausage-shaped muscle. And finally, don't be afraid to use a curved probe, especially for deeper targets to get a much better picture. You know, the incredible success of the ESP block really points to where regional anesthesia is heading, towards blocks that are safer, simpler, and just plain more effective. It really is a game changer, and it makes you wonder, what's the next big thing in pain management just around the corner?